So Charlotte, you would have seen this graph on the news. If this is time period, and this is number of infections, this is the peak that our government are trying to avoid. This is what is happening in Italy, Iran, and what happened initially, I believe, in China. If we assume that the infection rate is 80,000 people, this has happened in quite a short period of time. Now, let's assume this is the level at which our National Health Service could cope. Okay? Our government would like us to try and create a longer curve so that we have the same infection rate of 80,000, but over a longer period time. This, therefore, would come underneath the strain of the NHS. Why is this important? Now, Charlotte, if we take this level here at, say, 40,000, and we know the death rate is, say, 1% for coronavirus, how many deaths would happen underneath this line in this peak for 40,000?
400.
That's correct. If, however, once we've hit the strain of the NHS, this level, the further 40,000, the death rate would therefore go up because we're not able to care for them the same. Let's assume this goes up to 4% death rate. How many people would die of these 40,000?
1,600.
That's right. So in total, with this peak, how many deaths would we be looking at? This would be 1,600 plus 400 equals
2,000.
Very good. Now let's take, if we manage to keep this curve under the strain of the NHS, we've still got 80,000 people infected, but this death rate would remain at roughly less than 1%. But let's assume for maths and this equation, 1%. What would be the number of deaths? 80,000, 1%.
800.
Very good. So how many lives would this save? It would be 2,000 for this peak, but we could save, if we had 800, what would be the number of lives saved?
1,200.
Very good. So this is the number of lives saved if we manage to keep this curve. Now, everyone is saying, but we should be closing the schools. We should be self-isolating the nation in order to achieve this curve. But there are some factors to consider here. If we close the schools, that means children will be at home. There are key essential workers who wouldn't be able to go into work. Namely, Charlotte, where would these key workers be?
Doctors.
And?
Doctors and nurses.
That's right. So if we end up with too many staff off from the NHS covering the childcare at home, what happens to this line here, Charlotte, please? Does it go up or down?
Down.
Down, exactly. And therefore we have a new line that we have to try and keep this strain of the NHS under. This would actually create a more exasperated scenario. This is why we're delaying closing schools as long as possible. But children are super spreaders, as people say. And children have to congregate in a school So let's take your school as an example, Charlotte. How many children are in your school?
Around 640.
640. And in another large state school in the same area, how many children are in this school?
About 2,000.
Okay, so the logic between closing schools is because obviously if you have one infection here or here, you are potentially infecting large quantities of people. Now, say a big company, telecoms company, have told everyone to work from home, okay, because they were working in a big office. And again, they had 2,000 people. So they reduced their risk by saying all work at home and don't therefore congregate in the one workplace. Okay, this reduces risk. Companies can make this decision. They do not need to wait for the government to be telling them to do so, as long as their work allows them to work from home. We, however, at schools need to wait for the government to tell us to close schools. They do not have the authority to close the schools. And we have already established that if we close the schools, it will put a strain on the workforce for our essential workers. But we agree, we do want to try and achieve this lower curve. Therefore, there is actually something we can choose to do as individuals. If you work from home, if you are a stay-at-home parent, if you've already been told to work from home by your workforce, then in essence, you could make a personal judgment to keep your children off school. If we could reduce the number of children at school down to those that have essential workers, we may not need to actually close schools altogether at all. Imagine if, Charlotte, I take you and William out of school, and so do other working parents. We may now be able to get your school down to 300 people, and say if in the other large school they were able to reduce that to 1,500 children. What have we done by reducing the number of children at school? Have we increased or decreased the risk of infection?
Decreased.
That's right. It would mean they wouldn't be allowed to go out and play in the streets. They wouldn't be able to play with each other. They would have to stay at home, and we would have to do home learning. This is the decision we have made as a family. We don't need our children to go into school. We don't need them to increase the risk of super spreading into a large community of other children who may have parents who work as essential workers within the NHS. We can educate at home. We do not need to socialise with others. We live in a rural area. We could help bring this curve down using our own fruition. And maybe if the whole country, those that can do, we could actually help the government keep this curve under the strain of the NHS and allow essential workers to have a less risky place for their children to go to school and therefore also be able to stay at work. Is it definitely going to work? Who knows? But I very much feel far more positive trying to be proactive than sitting here waiting to be told and being told and fearmongered amongst the press, told that this is what we're going to end up happening and not this. I will do my part. Will you, Charlotte?
Yes.
Do you think others could?
Yes.
The only caveat, of course, is that I need to make sure that this is legal and that I will not end up in prison for taking my children out of school.